Regular prostate checks. Prostate cancer is one of the most common forms of cancer in men, and it is estimated that 1 in 8 men will be diagnosed with prostate cancer at some point in their lifetime. Despite its prevalence, many men are hesitant to get their prostate checked due to embarrassment or fear. In this video, we will discuss why it is important for men to have their prostate checked and how this simple procedure can save lives. First, let's talk about what the prostate is and what it does. The prostate is a gland that is part of the male reproductive system and is located just below the bladder. Its primary function is to produce and secrete prostate fluid, which makes up a portion of semen. As men age, the prostate gland can become enlarged, which can cause problems with urination and sexual function. Prostate cancer is a form of cancer that starts in the prostate gland. It is typically slow-growing and may not cause any symptoms at first. However, as the cancer grows, it can spread to other parts of the body, such as the bones, lymph nodes, and organs, making it much more difficult to treat. The good news is that prostate cancer is often treatable, especially if it is caught early. This is why it is so important for men to have their prostate checked regularly. A prostate check typically involves a digital rectal exam, DRE, and a prostate-specific antigen, PSA, blood test. During a DRE, a doctor or nurse will insert a gloved, lubricated finger into the rectum to feel the prostate gland. This may sound uncomfortable or embarrassing, but it is a quick and relatively painless procedure that can be done in just a few minutes. The doctor will check the size, shape, and texture of the prostate gland to look for any abnormalities or signs of cancer. A PSA blood test measures the level of prostate-specific antigen in the blood. This protein is produced by the prostate gland and can be elevated in men with prostate cancer. A high PSA level does not necessarily mean that a man has prostate cancer, but it can be a sign that further testing is needed. Together, a DRE and PSA test can help doctors detect prostate cancer in its early stages, when it is most treatable. Men should start getting regular prostate checks at age 50, or earlier if they have a family history of prostate cancer or other risk factors. Some men may be hesitant to get a prostate check because they feel embarrassed or uncomfortable. It is important to remember that doctors and nurses who perform these exams do so regularly and professionally. They are trained to make patients feel comfortable and at ease during the exam. Additionally, the discomfort or embarrassment that may be felt during the exam is temporary and minor compared to the potential consequences of not getting checked. Other men may be afraid of getting a prostate check because they fear that it will be painful or that it will affect their sexual function. While it is true that an enlarged prostate can cause problems with urination and sexual function, a DRE itself should not cause any pain or affect sexual function. It is also important to note that getting a prostate check is not just important for men who have a family history of prostate cancer or other risk factors. Prostate cancer can affect any man, regardless of his age, ethnicity, or lifestyle. In fact, the majority of men who are diagnosed with prostate cancer have no known risk factors. In addition to regular prostate checks, there are also lifestyle changes that men can make to reduce their risk of developing prostate cancer. These include maintaining a healthy diet and exercise routine, avoiding tobacco and excessive alcohol consumption, and managing stress. In conclusion, it is important for men to have their prostate checked regularly. Prostate cancer is a common and treatable form of cancer, but early detection is key. A DRE and PSA blood test is a simple and relatively painless procedure that can be done in just a few minutes. Men who are hesitant to get checked due to embarrassment or fear should remember that doctors and nurses who perform these exams do so regularly and professionally. They are trained to make patients feel comfortable and at ease during the exam. Moreover, prostate cancer is a serious and potentially life-threatening condition. It can spread to other parts of the body and become much more difficult to treat. Regular prostate checks can help detect prostate cancer in its early stages, when it is most treatable. It is also important to note that men who have a family history of prostate cancer or other risk factors, such as African American men and men over the age of 65, are at an increased risk of developing prostate cancer. These men should be particularly vigilant about getting regular prostate checks. In addition to regular prostate checks, men can take other steps to reduce their risk of developing prostate cancer. Maintaining a healthy diet and exercise routine can help reduce the risk of developing many forms of cancer, including prostate cancer. Avoiding tobacco and excessive alcohol consumption can also help reduce the risk of developing prostate cancer. In summary, prostate cancer is a common and potentially life-threatening form of cancer that affects many men. Regular prostate checks, including a digital rectal exam and a prostate-specific antigen blood test, can help detect prostate cancer in its early stages, when it is most treatable. Men who are hesitant to get checked due to embarrassment or fear should remember that these exams are simple and relatively painless procedures that can be done in just a few minutes. Moreover, men who have a family history of prostate cancer or other risk factors should be particularly vigilant about getting regular prostate checks. By taking these steps, men can help reduce their risk of developing prostate cancer and potentially save their own lives. Like, share and subscribe for more health videos like this one.